Hello dear students, we will be continuing with the internal structures of the medulla. Like before we see the internal structures of the medulla, let us see the external features of the medulla. In the external features on the anterior ventral aspect of the medulla, we have your pyramid, the pyramids on both sides, right? On the anterior, lateral to the anterior median fissure. These pyramids are produced by the cortico spinal fibers, pyramidal fibers. Most of the pyramidal fibers will cross to the opposite sides, that is 75%. 75% of the pyramidal fibers will cross to the opposite side in the lower part of the medulla, and then they will descend as the lateral corticospinal tracts in the lateral white column of the spinal cord. About 20% of them do not cross, and they will descend as the anterior corticospinal tract in the anterior white column of the spinal cord, and the remaining 5% will run downwards along with the uncrossed fibers in the lateral white column of the spinal cord. Then we will see lateral to the pyramid, we will see an elevation known as the olive elevation. These are produced due to the gray matter that is your inferior olivary nucleus. Then in between the pyramid and the olive, we have the rootlets of the hypoglossal nerve. Then on the lateral aspect, lateral to the olive, we have the inferior cerebellar peduncle. The rootlets of the 9, 10, 11 cranial part of the 11 cranial nerve will emerge through the posterolateral sulcus, that is the sulcus between the olive and the inferior cerebellar peduncle. Features on the posterior aspect, we have two areas. We have the closed part and the closed part that is on the lower part, and the open part in the upper part. So the closed part on either sides, on either side of the posterior median sulcus have your three longitudinal elevations from medial to lateral. They are fasciculus gracilis, fasciculus cunetus, and inferior cerebellar peduncle. The upper end of the fasciculus gracilis and fasciculus cunetus are expanded to form the gracile and the cunate tubercle, respectively, which where the underlying gracile nucleus and the cunate nucleus are present. In the open part, it forms the lower part of the floor of the fourth ventricle, where we will see the median sulcus, hypoglossal triangle, and the vagal triangle. Coming to the internal structures, we will take the internal structures on 4 levels. One level is at the point of decussation of the pyramid, and another point will be at the decussation of the medial lemniscus. Medial lemniscus, The second level we will take is at the level of your nucleus gracilis and nucleus cunetus, just at almost at the apex. And the third level we will take is at the level of your floor of the fourth ventricle. And the fourth level, on the uppermost level, is at your just at the base of the triangle. So the first level we will take is at the level of the pyramidal decussations. So in the pyramidal decussation, we will see on the nucleus gracilis and the nucleus cunetus will be present on the posterior aspect of the central gray matter, and the apex of the posterior horn, we will see the spinal nucleus of trigeminal nerve. This is considered to be an upward extension or continuation of the substantia gelatinosa in the posterior gray column of the spinal cord. Just dorsal to that is your spinal tract of trigeminal nerve. And on the ventral aspect, we have the pyramidal decussations, which form most part important features of the medulla at this level. So here we have 75% of the pyramidal tracts running running backwards and laterally. So the pyramidal decussations will be here. They will run backwards and laterally, and they will reach the lateral white column of the opposite side of a spinal cord, where they will run downwards as the lateral corticospinal tract. In doing so, these anterior horns are detached from the central gray matter. So the detached anterior horn will form the spinal nucleus of accessory nerve. Spinal nucleus of accessory nerve. The spinal nucleus of accessory nerve will extend up to C5. And at this level, we will also see in the lateral white column, we will see the dorsal and the ventral spinocerebellar tracts and the lateral spinothalamic tracts. So it was at this level that we have taken this section. The next section we will take is at the level of the sensory decussation, that is where your medial lemniscus will be formed. We have here on the posterior aspect, we have the nucleus gracilis and the nucleus cuneatus, which have been detached from the central gray matter. And the fibers of this fasciculus gracilis and fasciculus cuneatus will occupy the broad posterior white column. And they will terminate in this nucleus. The internal arcuate fibers, these are the internal arcuate fibers, arises from the cells of the gracile and the cuneate nuclei as a second order sensory neuron. They will run forwards and medially around the central gray matter and decussate with the opposite with the corresponding fibers of the opposite side in the median plane. So this is where the sensory decussation occurs. And they will turn upwards as the medial lemniscus. Now, the internal arcuate fibers will cut off the spinal nucleus of trigeminal nerve from the central gray matter. Dorsolateral to the cuneate nucleus, we have the accessory cuneate nucleus. This will give rise to the posterior external arcuate fibers. The spinal nucleus and trigeminal nucleus are also present, ventrolateral to the cuneate nucleus. And the lower part of the inferior olivary nucleus is also present here. The pyramids will lie on either side of the anterior median fissure. Now the central gray matter will have nucleus on both sides, from the medial to the lateral. We have the hypoglossal nucleus, dorsal nucleus of vagus, and nucleus of tractus solitarius. See this image. So you see here, this is the hypoglossal nucleus, nucleus of vagus nerve, and nucleus of tractus solitarius. This will be present around the central gray matter. Then we have the medial longitudinal bundle, which lies posterior to the medial lemniscus. Then we have the spinocerebellar tracts and the lateral spinothalamic tract. Another section is at the section of the medulla at the level of the olives. I have shown you that at the level of the olives here, we will have a section here, right, at the level of the olives. So in a transverse section, it will look something like this. The central gray matter will be spread over the floor of the fourth ventricle. So this is the open part. Okay, and it will present these features. From medial to lateral, we will have the hypoglossal nucleus, nucleus intercalatus, dorsal nucleus of vagus nerve, nucleus of tractus solitarius, and vestibular nucleus. And nucleus ambiguus is lying deep within the reticular formation. Nucleus ambiguus will give origin to the motor fibers of 9, 10, and 11 cranial nerves. On either side of the midline, we have the medial longitudinal fasciculus, the tectospinal tract, and the medial lemniscus, and we have the pyramids. Just in front of the pyramid, that is anterior to the pyramid, we have this arcuate nuclei. Arcuate nuclei is thought to be a displaced pontine nuclei. The arcuate nuclei will form anterior external arcuate features, arcuate fibers, anterior external arcuate fibers. Okay. So laterally we have the inferior cerebellar peduncle and inferior olivary nucleus. Inferior olivary nucleus is the largest mass of gray matter, and it is a prominent feature of the upper part of the medulla. It looks like a crumbled bag-like appearance. Close to the inferior olivary nucleus, we have the medial and the dorsal accessory olivary nucleus. The last transverse section we will take is at the level of just inferior to the pons, that is at the pontomedullary junction. So in this area, the lateral vestibular nucleus will replace the inferior vestibular nucleus, and also we will have cochlear nucleus. Cochlear nucleus are visible at this point, so it will be almost the same as the sections that we had in the lower part of the pons. So the cochlear nucleus, we have the dorsal and the ventral cochlear nucleus, which will be present dorsal and ventral to the inferior cerebellar peduncle. The blood supply of the medulla, it mainly involves the posterior inferior cerebellar artery and vertebral artery. Now there are two syndromes that is related to the medulla, which we will discuss. One is the lateral medullary syndrome of Wallenberg's, also known as the posterior inferior cerebellar artery syndrome, lateral medullary syndrome of Wallenberg's. Now, in this, there is thrombosis of posterior inferior cerebellar artery, and the structures which will be affected are because of the involvement of the spinothalamic tract. There will be contralateral pain, loss of pain and temperature sensation in the trunk and the limbs. And due to the involvement of the nucleus of trigeminal nerve, there will be ipsilateral loss of pain and temperature sensation over the face. And due to involvement of nucleus ambiguus, there will be ipsilateral paralysis of muscles of the palate, the pharynx, and the larynx. And due to involvement of the inferior cerebellar peduncle, there will be ipsilateral ataxia. And due to involvement of vestibular nucleus, giddiness will also be present. And due to the involvement of the reticular formation, which will give the sympathetic pathways, we will be experiencing Horner syndrome. The patient will be experiencing Horner syndrome. Now, in the case of medial medullary syndrome, this is when there is involvement of the vertebral artery, branches of the vertebral artery. So as you can see, it involves the hypoglossal nerve. So if it involves the hypoglossal nerve, there will be ipsilateral paralysis and atrophy of half of the tongue. And due to involvement of the medial lemniscus, there will be contralateral loss of position and vibration. And here we can see clearly that it involves a pyramidal tract, so there will be contralateral hemiplegia.